Very important election on November 6th, so let's preview that with AARP Wisconsin. Lisa Lamkins is a Federal Issues Advocacy Director for AARP Wisconsin. Lisa, thanks for coming in.
Happy to be here.
Well, how important is this November 6th election? What's at stake, especially for AARP members?
You know, there is a tremendous amount at stake in this upcoming election, and that's why we have been really urging people to get out and vote. I think it's not unfair to say things like Social Security, Medicare funding, Medicaid, support for family caregivers, the cost of prescription drugs, all of those issues are really on the line in this upcoming election.
Well, how many members does AARP Wisconsin have?
You know, in Wisconsin we have over 852,000 members just in this state.
And do they vote? Now, they're over 50, right? You have
Correct.
to be over 50 to be in AARP?
Yes, you've got to be over 50.
I qualify. Okay. Do they vote in higher percentages than the rest of Wisconsin's voting age population?
You know, they do. Older voters are reliable. They tend to turn out. They really do have the power to decide elections. But even in midterms, older voters sometimes don't get out. They think it's not as important as a presidential year. And that's why we're really focusing on boosting voter turnout among those age 50 plus.
Well, now, your members or anybody can go to your website because you've got a special page on your website, Government and Elections.
We do.
And that's kind of the intro to some of these issues.
It is a terrific source of lots of information. It's aarp.org/vote. You can get information on voter registration. You can see where AARP stands on the issues. You can find out where the candidates stand. There are links to local candidate pages. It is a terrific one-stop shopping for lots of election information.
And you probably linked to the more than 200 interviews that WisconsinEye did.
Of course we did.
Well, thank
yes.
you. Thank you very much. But you're also proactive in different ways. Now, talk to me about the van. You've got a specially decorated van.
So we have been driving around in the AARP voter van all summer long. And I know because I have driven it thousands of miles. Overall, we've taken this van over 8,000 miles just around the state of Wisconsin. And we've been at over 50 stops. We've been to Superior, we've been to Kenosha, we've been to La Crosse, we've been to Sheboygan. We have been everywhere in between. We're out talking to older voters. We're making sure that people understand the importance of the election. And we're actually asking people to pledge to vote. It's a symbolic pledge. It just says, yes, I'm going to be the difference and I'm going to vote on November 6th.
But you're a nonpartisan group. How do you walk that fine line when all the polls say Wisconsin, indeed the nation, is as polarized as, no, let's use the nicer term, divided.
Divided,
as
yes.
It is.
Well, you know, we absolutely are nonpartisan. We don't support or endorse any candidates. We do not have a political action committee. We don't give money. We don't allow any campaigns to use our names in their ads. But what we do is focus on the issues. We want to make sure that voters understand where candidates stand on the issues. We want them to know how important these issues are. People don't really think that you know, the vote they cast in November will determine the kinds of policies and proposals that get put out by Congress in February. But that's exactly the case. And so we want people to know they can have a real impact on the next Congress.
This is a midterm election. So are you finding not as much interest in a midterm election as the presidential in 2016 and fast forward to 2020?
You know, it's interesting. I've been at AARP for a long time. AARP's done voter engagement for a long time. I have to say, I think there's a lot of enthusiasm around this election. In the past, we have found midterm elections to be a little bit more ho-hum, where voters are like, yeah, maybe I'll make it, maybe I won't. Mm-hmm. When we've asked people to sign voter pledges, almost unanimously, people are like, heck yes, I'm going to get out, I'm going to vote. And we couldn't be more thrilled to see that. We just want to make sure that enthusiasm carries through Election Day.
You also do what's called postcard parties. So you drive there in the van, and postcard parties, who's invited? How do they work?
Well, you know, in fact, it's a little bit old school in some ways. It is an old-fashioned postcard writing party. We've done it in several communities around the state. We've had AARP volunteers who have also invited their friends and neighbors come, and we give them.
So you don't have to be an AARP member.
You don't? Nope, absolutely not.
Excuse me.
Anybody can do that. We have people write out postcards to AARP members, generally AARP members who drop off in the midterm election, and we give very positive messages. Be the difference, vote. Your vote makes a difference. Have a plan to get out and vote on election day. Again, we're nonpartisan, so we don't mention any parties, we don't mention any candidates, but we give people our website where they can get more information and just give a nice note of encouragement.
So the message with the postcard parties is vote.
Vote.
Without any specific awareness of issues, just vote.
It's vote. They're very personalized postcards. Volunteers could write whatever they wanted. Some volunteers said, hey, Social Security and Medicare are on the line. Make sure you get out and vote in the next election. Some volunteers were much more generic, help our democracy work. Please go vote. But they're personalized messages, and hopefully they'll make a difference in the areas that we have the postcard parties. And they were a lot of fun, too.
Now, you also have what's called community conversations.
We do indeed.
And how do those work? Because at those, don't you get some people standing up and saying, I'm for the president, I'm against the going back to how divided and how vigorous the dialogue is around this election.
Well, it's interesting. Last week we had a community conversation in Sheboygan, and I was kind of ready for, I think some enthusiastic discussion among the crowd. Again, we kind of went old school, and we let people voice their opinions using some red and green paddles, kind of a red thumbs down or a green thumbs up. But we actually had a really good discussion. There were differences where people thought on the issues, different ways you could fix Social Security, for example. But the people in the room had a positive, healthy, fruitful discussion. And I think what it really shows is that voters want our elected officials to come together and work on these issues, and they want them to do it in a civil way. And actually sort of focus more on the people that elect them than on all of the rancor and the name calling that we've been having.
How do you pose these tremendously important issues in a nonpartisan way? These questions. So they raise paddles. And what's a typical question you would ask them at these community events? Well,
we would start off, pretty lightly. Is Social Security an important election issue to you? Yes or no? Yeah. So people say yes, and then we say, okay. So we've talked a little bit about the issue, perhaps. And there are many different options for Social Security solvency, for example. One might be to raise or eliminate the payroll tax cap. And so we kind of ask people about that, and they give us a thumbs up or a thumbs down. Do they support eliminating it or raising it?
Do you tell them that it's scheduled to go to not, okay, there are two dates. The first date that that the payouts are going to exceed income is when?
2020.
Right. And then after that, there's another very potentially dangerous date.
So in 2020 is when we're going to have to start redeeming some of the trust fund bonds.
Yes.
In 2034 is when the trust fund is going to run out. We do remind people, of course, that the payroll tax still continues to be collected. So while there are some folks who want you to think that Social Security is not going to be there because the trust fund will be gone and eliminated, there's still going to be enough money coming in through the payroll tax to pay about 75% of benefits. Now, that's not good enough, right? People have worked their whole lives. They've paid into this system. It's an earned benefit. It's not an entitlement. And so we want to make sure there's 100%. So then we talk with folks. Do you
talk about the options?
We do. That's what we do. We talk about the options. Raising the age.
Means test.
Means testing. Changing the way the cost of living adjustment, the way the COLA is calculated. Privatizing Social Security, putting the money into private accounts.
That was floated under President Bush.
It was.
And
we
went
stopped
essentially nowhere.
Right. That's not an option that we necessarily support. But when we have these community conversations, I talk about the options, and we let the audience tell us what they think. It's really a listening opportunity for us. To listen and hear what are people thinking. What options do they like? What options don't they like? I will just mention in Sheboygan, raising or eliminating the payroll tax cap was wildly popular.
It was.
Yeah, it is in most places.
And then how do you handle it when somebody stands up and says President Trump is A, great, or B, bad? Do you cut them off? Because that's a partisan statement. You're a nonpartisan group.
What we really say is we just remind people that we are nonpartisan. sometimes we have a board at the back of the room. We had an issue board at the back of the community conversation where we would invite people to write out any comments that perhaps weren't very friendly. So we let people have their say. As you know, as long as they're making a point in a way that's not denigrating to another point of view, we'll let people talk. I always remind people that we're nonpartisan, and it seems to work pretty well.
Do you bring up just specific issues? Let's just talk federally. If somebody brought up, let's build a wall, is that an issue that would you say AARP is not really engaged on?
Exactly. We don't have policy on that, so I would invite someone to put that issue on our issue board at the back of the room, but we're not going to discuss it as a group because that's not an issue. It's not an issue, frankly, that our members have told us is important to them. It's not an issue we have policy on, and so we're not going to discuss it at our AARP event.
Now, walk me through how you brief them on Medicare, given the huge healthcare debate in this nation.
Well, I will tell you, we darn near ran out of time in Sheboygan last week.
That's number one issue the polls say.
It was huge. Healthcare was huge. It was huge, and that's really what people wanted to talk about. And I was impressed at how people were really willing to share their personal healthcare experiences, their healthcare challenges, the number of people in the room in Sheboygan who were struggling with healthcare costs and with drug costs. We sort of talk about the next Congress is going to have to deal with Medicare funding. Who you vote for in November will decide the kinds of policies that get raised or that get passed in the next Congress. Medicare funding is a huge issue. It takes about 15% of the federal budget, so it always comes up. And especially we've been hearing in the news, our debt's rising. We've got, the only way to deal with it is to cut entitlements. Well, we think there are lots of other ways to deal with that. But when we talk about Medicare, it always seems to be on the chopping block. We just want people to understand there are different ways to sort of reform and modernize Medicare. You can look at ways to bring down healthcare costs, which we have to do. Or you can, another option is to push more of the costs onto seniors, which certainly brings down the cost of Medicare for the federal government, but leaves seniors who are already struggling with more and more problems.
How do you straddle the divide between those that say Medicare for all and repeal the Affordable Care Act? How do you, that's a huge continuum.
It is a huge continuum. What's interesting is I think more of our members are so focused on trying to make sure that their families can afford health care, the way we get there becomes less important. Whether it's opening up Medicare for everyone, whether it's repealing the Affordable Care Act and finding skimpier plans that people could rely on, people are so worried about their own personal situation that I think if we could talk about those policy options and about ways to bring that about, ways to bring down healthcare costs, that's what people are really interested in.
So in this chasm between Medicare for all and repeal the Affordable Care Act, how do you direct your members and others at these community events to get information on where the candidates on their ballots November 6th stand?
Well, I'm glad you asked that because actually AARP right now is doing kind of a big push. During the repeal of the Affordable Care Act, the attempts to repeal it, AARP designated a couple of key votes, and we told members of Congress that we were going to hold them accountable for their votes to repeal that. Unfortunately, repealing the Affordable Care Act really hurts older people. People with pre-existing conditions.
That's not a partisan statement you just made?
It's not a partisan statement.
Thank
it's an
you.
issue-related statement.
Okay, thank you.
We support issues, and we supported the Affordable Care Act. People can find out where their member of Congress voted to repeal the Affordable Care Act at that website at aarp.org/vote. There's one of the sections in there talks about the healthcare votes, and you can find out exactly where your member voted.
Does that lend itself then to a partisan conclusion on the part of the voter?
No.
I like candidate X, I don't like candidate Y?
I don't think it's a partisan conclusion. I think it's finding someone who reflects your values. It's a public vote. It's, there's no good or bad statement about it. If you think that the Affordable Care Act should be repealed, then you should look for someone who voted to repeal it. If you don't think that's a good option, then you should look for someone who voted against it.
So you want your members to go to the polls and cast an informed opinion.
Absolutely.
So we've talked federally about Social Security and Medicare. What's the third most important federal topic that you want your members informed on?
I think it's Medicaid.
Medicaid. 1 in 5 or 1 in 6 Wisconsin residents get all or part of their health care through Medicaid, excuse me.
Yeah, and I think, the thing that people often don't think about, a lot of people think about Medicaid as health care provisions for poor people. But what people often forget is that Medicaid is the #1 funding of long-term care. And so seniors, people with disabilities really rely on Medicaid. It pays for nursing home care. It pays for, in Wisconsin, we've done a good job of using those Medicaid dollars for home and community-based services, things that help people stay in their homes and their communities. Without that Medicaid money, those options wouldn't be there. And so people might not think it's an issue that's important to them, but it's vitally important to older folks in Wisconsin. And I think it's not exaggerating to say the very existence of Medicaid depends on the next election. There are a lot of people who would like to eliminate it or make it much harder to apply for or to maintain it with things like work requirements or lifetime limits. On the other hand, there are some states who want to expand it. There are referendums in places like Nebraska to expand Medicaid. So it really is an issue that people should get informed about.
And they should know that in Wisconsin, the Department of Health Services projects that in the fiscal year 2021, Medicaid will cost $11 billion for the first time in Wisconsin. Yeah. So it is a huge issue.
It's a huge issue.
It's a shared state-federal program. I think 59% of Medicaid is from the feds.
Correct.
The remaining, of course, comes from state government. So it's a huge consumer of our general fund tax dollars.
Right.
So it's also then crosses the line into a state issue. So do you have a position on whether our Medicaid reimbursement rates are too low? Because some medical professionals and hospitals say yes, they are.
It's interesting. We haven't really focused so much on the Medicaid reimbursement rates. We have focused more on access. For example, AARP would have liked to have seen full Medicaid expansion taken by Wisconsin. I've just seen a report.
The Journal Sentinel story says over the course of not taking it, Wisconsin has lost $1.1 billion. Excuse me, I keep interrupting you.
No, that's a huge, and that's exactly what I was going to say.
That's the top line story in today's Journal Sentinel.
Absolutely. That's huge. We could have taken that money and we could have used that money in Wisconsin to serve more people and to help out our own state's budget.
But to quote the Assembly Speaker, Mr. Voss, why do we want to take money for a, quote, failing system? We're getting into this partisan fine line that AARP has to walk, aren't we?
I think it's a political line. It's not a partisan line because AARP is political, even though we're not partisan, which means
we have registered lobbyists.
Right. We support.
Come up and try to influence policies.
Absolutely. We support issues based on the issue. We don't support or oppose issues based on which party supports or opposes it. So Medicaid is important for the most vulnerable people in our state. And so expansion of Medicaid is something that we absolutely support.
Well, as a policy decision, here you have a clear choice on November 6th. Governor Walker has not taken the money, although he has covered everybody that's up to the federal poverty line.
Correct.
He's flexed it that way. Mr. Evers said at last Friday's debate, I would seek to expand. But you're not telling your members to vote then for Mr. Evers?
No, we're telling our members to vote for the candidate that most reflects their values. We think there are good reasons why Medicaid should be expanded. And we'll continue to fight for that regardless of who is in the governor's seat or who maintains control of the legislature. We'll fight for that as an issue, and it'll be up to voters to figure out which candidate reflects their values.
Now, I'm intrigued. You mentioned caregiving. Your numbers show 578,000 Wisconsin residents are caregivers for a family member or someone they love.
Right.
What's the issue in the capital that AARP is framing as a major potential policy decision?
We actually have two big issues surrounding caregiving. One has to do with the CARE Act, which would help caregivers when a loved one is discharged from the hospital. It gives them a little bit more information. It actually indicates that there's a caregiver around. And it also helps to make sure that caregivers get the training that they need when someone leaves the hospital. It can be a scary thing to all of a sudden come home, with your spouse or a friend or an aunt or some other family member and say, well, okay, now you have to give them an injection.
Yes.
Gosh, if you've never done that before, wouldn't it be nice if there was some training? So we're pushing to have this kind of CARE Act passed here in Wisconsin. Tons of other states, and I don't know the exact number, of 35, 40 states have passed it. But a lot of other states have done it, and we're focusing on that in Wisconsin. We also know those 578,000 caregivers spend a lot of their own money helping their loved ones out. And so we'd like to see a caregiver tax credit to kind of help folks. I think they spend on average something like $7,800 out of pocket when you pick up the medicines for your mom when you go to help her out, or all of a sudden your dad needs a ramp to get into the house. So, you pay the money for that. Caregiving comes at a very high cost to those caregivers.
So those are two of your priorities for the next session.
Correct.
Who would train the caregiver and how to give a shot to someone they love?
There are nurses, there are other professionals within the hospital system who would be able to show caregivers how to make those things happen.
Hospitals have concerns about the Caregiving Act because it's one more level of one more thing they'd have to do. Their staffers would have to do. Your answer?
Well, my answer to that is they also have said, well, we're already doing it, so we don't need an act to, kind of prove that we're doing it. Well, if they're already doing it, then there shouldn't be an issue at all in making sure that it happens across the board. I think, nurses want to make sure that their patients are well cared for when they get home, and doctors and everyone within that hospital framework. And I think it's really a win-win, actually. If a caregiver knows how to provide for someone at home, the chances that they'll end up back in the hospital are far less likely. So we'd really like to see the Hospital Association come around and provide support for some of these family caregivers across the state.
The stats, I want to stay on caregiving because it's so important. It's going to become more important as Wisconsin ages. The stats that your organization has developed in terms of how many caregivers have to lose time at work, rearrange their work schedule, cut back to part-time, or maybe even quit a job temporarily while they provide caregiving. Those are very impressive.
It's huge. And a lot of times too, when we think about caregivers, we think about sort of the average caregiver who looks like me, sort of mid-50s, a woman. But AARP also just released a study that a huge amount, like 25% of caregivers are millennials. So we've got younger people who are providing caregiving to family members
who are
as well.
Putting parts of their personal or professional life on hold while they caregive.
Absolutely. And it's hard to sort of figure out, people don't take promotions because they're afraid it will take much more time and they need to be able to take time off for caregiving. Sort of the stress and the burnout on family caregivers is tremendous. I mean, it's not just the actual time off, but it's passing up promotions. It's a lot of things that where we really need to show support. We're talking 578,000 caregivers just in the state of Wisconsin. It's really crazy that we're not doing things to support them.
Isn't our population 5.7? So that's 1 in 10.
Yeah,
it's
exactly.
1 in 10. You also ask people to sign pledges to vote. How does that work?
Well, it's been great, actually. So we've been at tons of different in-person events. We have volunteers all over the state who have been asking people to pledge to vote. But the interesting thing is you can also pledge to vote online. It's a generic pledge. It just says, hey, I know this election is really important, and I pledge to be the difference and vote in this upcoming midterm election. And people can go to that aarp.org/vote and sign an online voter pledge.
Do you have the technical wherewithal to check at 3 or 4 o'clock on election day whether those people who have emailed you, I promise to vote, have indeed done so?
I don't think we have that capability yet, but I sure wish we did, because I will say I hope to send an email to everyone who pledged to vote, who gave us our email, to remind them to get out and vote. And of course, I would be remiss if I didn't mention, and we've seen lots of stories about the early voting as well. We keep talking about getting out on Election Day on November 6th.
27% of Wisconsin's votes for president in 2016 were early or absentee votes. So are you encouraging your members to absentee vote?
Absolutely. I think as long as people have a plan to vote, if you know when you're going to vote, if you know, make sure you know where your polling place is. If you have problems with transportation or issues, make sure you know how you're going to get to the polls and who might be able to help you get there. It's kind of having that plan. If you decide to vote on Election Day, that's terrific, but there are lots of other options. And again, that aarp.org/vote, it will actually take you to information where you can link into your sort of local municipality and get all the information about local voting.
Do you talk about curbside voting for someone who's disabled? Are you aware of that? That if you go in, someone is disabled and they're in the car outside, somebody can go in and say, hey, there's a voter outside who can't enter, and supposedly 2 poll workers are supposed to come. That's a fascinating.
I just read an article about that today, actually, and it's something that I was not necessarily aware of. So I think that's a terrific resource for people to know about.
What is AARP doing in this election cycle that it wasn't doing in 2016, 2014?
You know, in the past, we've really focused on making sure that the candidates and voters know about our issues. And while we're still doing that, I think the whole focus on voters and boosting voter turnout is relatively new for us. In the past, we used to do voter guides. We'd ask candidates, here are 5 questions, give us your answers. Well, over time, those voter guides seemed to be less important. Candidates were less willing to answer them or answer them with any substantive answer. And also voters seem to be a little less interested in, kind of reading some of those differences. So we have focused more on just making sure that people get out to vote. But this is where our partnership with WisconsinEye and getting some of the candidate interviews has also been terrific, because we do want people to know where candidates stand, and the interviews are a great place to find that out.
Well, thank you. But you have this difficulty. Medicare is so complex. Medicaid is so complex. Social Security, such different options. You have to boil these down to understandable talking points. That must be a huge challenge.
It is a challenge. We do, of course, have 2-page long issue papers on all of those issues, which are at that AARP website. Okay. So people can read up a little bit more on those. But we do have a couple of sort of pithy little bullet statements as well. And we have questions that people can ask candidates. What will you do to make sure that Social Security is solvent for future generations? They're very short and simple questions. I would also encourage people, if they're AARP members, the AARP Bulletin has had terrific stories about the election. And the recent edition has a story about sort of the top 10 reasons to get out and vote this fall. So I encourage people to take a look at that.
Okay, well, we're almost out of time, but this is a very important election, November 6th. And what's at stake again? Give us the closing argument.
What's at stake again? This next Congress is going to be able to decide things like Social Security solvency, Medicare funding, the future of Medicaid, support for family caregivers, and what happens with prescription drug prices. It's a critical election, and we really encourage people to get out and vote.
Okay, so one of your members just heard your closing remark and said, I'm not registered to vote. How do I register? Do you also answer that question?
Yes, if you go to the aarp.org/vote, it will provide you a link if you have questions about voter registration. It obviously links you to Wisconsin-specific and municipality-specific sites, but you can get it all at the aarp.org/vote.
AARP Wisconsin is doing more than ever to get your members out.
We sure are. We hope they show up.
Thank you very much. Lisa Lamkins is Federal Issues Advocacy, Director for AARP Wisconsin. Advocacy, I can say it. Thank you very much.
Thanks.
Thanks.